My name is Nebiyou Hailemariam. I'm a quality improvement technical advisor for NEST 360 program. So I'm trying to explain about how data is practically used in NEST 360 facilities in supported countries. Yes, data saves lives, but it should be used appropriately. When it is appropriately, it will contribute for providing appropriate decision-making approach and action items that could contribute for the survival of our babies. So in our program, we use data for action based on the framework of data to impact framework. So that has, the first thing is we collect different kind of data that could support the intervention for survival of babies. So the second thing is we synthesize the data to get insight. That insight will be analyzed in different levels that contribute a lot for especially for the facility teams to take an action based on the synthesis provided from that data. Then the third one is based on that we'll develop action items. So from our experience, from the quality improvement perspective and other interventions like clinical intervention and biomedical intervention, we use those data to see the gaps and to identify the gaps, and based on the identified gaps, we also suggested actions. That action also supported by the data we collected from the facility level. So, and the most important thing here, we use the data at the ground level, at the facility level. In most cases, in most of our countries, the data is collected for the sake of reporting to a higher level based on the hierarchies. But in our cases, we use a cylindrical approach. Most of the data will be consumed by the facility teams, a quality improvement team, biomedical engineers, and the clinical team, even the leadership to decide the most important resource allocation to the care provided at the newborn unit. So that is the most important pillar. So we use the data based on creating a learning platform as a facility, as a country, at the inter-country, multi-country level. So that kind of learning platforms also help us to facility team to deep dive to their data, to find the root causes of the problem, and to find the solution based on the suggested items from the evidence we found from the collected data. And the last one is we also try to link all the process, all the actions implemented on those facilities with the impact. So we collect data related to impact, like mortality, changing behaviors, and what kind of things or problems are solved at the facility. So that helps us to see our progress towards the targeted objective. So across this framework, we collect data, we synthesize and get insight. We use that synthesis for action development, and we link it with impact. Then we'll see behavioral change at the facility level and impact at the national level. Well, the most important thing that helps us to move the system, the health system, to use the data instead of collecting it as one. In NEST 360, we developed a dashboard, a quality improvement dashboard. That dashboard helps the facility team to access their data with a simplified visualization. And that simplified visualization has a lot of components that integrate different aspects of our intervention, starting from the admissions, the resource required for implementation, detailed clinical coverage and quality of care data, including device functionality and availability of human resource at the facility level to do the action items that are required for the survival of babies. So the most important thing is that dashboard could be accessible at different levels, at the facility level, at the region, and at the ministry, so everyone can communicate easily with that kind of visualization. The second is most of the facility, most of the programs, they are focusing, when they try to measure the data utilization, they are focusing on the number of logins by different actors. But in our cases, we know that there are a lot of individuals are logging in the facility. Like we do have more than 1,000 logins for the last 3 years. But we are focusing also how those data also utilized, and each facility members are and the leadership accountable for the change need to be happen in that particular facility in the new unit. So we use different platforms like data for action meetings, weekly discussion, virtual sessions, cross-country learning sessions, and there are also programmatic level discussion and dissemination. So that motivates the staff and the team or the leadership to use the data And so we measure data utilization not by logging, but the change happening in the coverage indicator and the quality indicator and the outcome level indicator. So that tells us a lot, and that also helps us to move the system to use their data appropriately. And the other thing is we also try to create an accountability system across the structure, starting from the ministry to the facility. So whenever we see some kind of gaps and whenever we see some kind of big learning opportunity, we'll try to link across the structure, and that creates also an accountability. So the health system also question by themselves whether they are using the NIST dashboard or the data available within the system. So it helps us a lot to move the system from the data collection tendency to what is utilizing that one. And we believe that it changes also the health information system within those supported countries, thinking beyond reporting to the hierarchy, but using at the facility level, because we noticed that there are some scale up in ownership in each country, and Ethiopia, Malawi, and other countries also adopting this platform and making their own the dashboard, and they are also using their own server to collect those information and to synthesize and utilize it. So that makes it a good signal of we are also on the right track to use data for decision making.